So let's stop and talk about what can you do as soon as you get bit. It takes 48 to 72 hours to get results. Most doctors don't want to prescribe unnecessary antibiotics when you don't know if you have an infection, and you also don't know what pathogens you're dealing with without those test results. So I want to focus on trying to inhibit the transmission process. Spirochetes enter the bloodstream. They grab onto endothelial cells on the blood vessel wall via adhesins on the spirochete body. Spirochetes release cytokines to loosen the endothelial cell junctions to gain entrance into the extracellular matrix. Borrelia loves it here because there's less immune cells and lots of tissue to break down, tissues filled with collagen and gags. So the body senses flagellin, an inflammatory protein from the flagella of Borrelia, and this activates nuclear factor kappa beta from the endothelial cells. Nuclear factor kappa beta causes immune and inflammatory responses, and Borrelia uses these responses to further enhance inflammation and immune cell proliferation to increase the infection site and break down the tissues they need to feed from. Inhibitors of nuclear factor kappa beta include astragalus, cordyceps, boneset, petunia, Japanese knotweed, kudzu, red sage, skullcap, and ashwagandha. This whole process starts by something called inhibitor kappa beta kinase breaking down inhibitor kappa beta to actually release the nuclear factor kappa beta. So using inhibitor kappa beta kinase inhibitors like cordyceps, red sage, and Chinese cat's claw can help to stop that process to begin with. Spirochetes also release the enzyme aggrecanase to break down aggrecan and release additional nutrients they need to feed. Aggrecan is a proteoglycan found in the extracellular matrix and cartilage and is found most abundantly in articular cartilage of the joints. So this is one of the reasons why Lyme migrates to the joints. A natural aggrecanase inhibitor is Japanese knotweed. Spirochetes also secrete hyaluronidase, which is an enzyme that breaks down hyaluronic acid. Hyaluronic acid breakdown causes a loosening in the connective tissue matrix and epithelial cell junctions. If you can stop hyaluronidase, you can stop the bacterial movement throughout the body. Hyaluronidase inhibitors include echinacea, which actually helps to strengthen the mucous membranes and skin, and ashwagandha. Mitogen activated protein kinases are also stimulated by Borrelia. These are the primary pathways used by Borrelia to enter a new host. They stimulate the cytokine cascade. There are three primary classes: ERKs, JNKs, and P38 kinases. Cordyceps, Japanese knotweed, and skullcap inhibit all three of the pathways, and kudzu also helps to inhibit ERK. Interferon alpha causes tissue inflammation, organ damage, autoimmune conditions, fever, fatigue, and low white blood cells. It stimulates indoleamine 2,3-dioxygenase. Inhibitors of interferon alpha include Japanese knotweed, red sage, and skullcap. Indoleamine 2,3-dioxygenase is an enzyme that breaks apart L-tryptophan. It breaks it into three components. It also severely decreases melatonin and serotonin. Now, I'm sure most of you have patients who have mood disorders, are depressed, and have insomnia. I know I do. And this explains it. So when you break apart tryptophan, you cannot make serotonin or melatonin, and you have rising levels of both 3-HK and quinolic acid. Also, you have a decrease in T cells. IDO inhibitors include skullcap, iastis, and crinum. Quin causes overstimulation of the neurons in the brain and degradation of brain tissue, reactive oxygen species, and sometimes seizures. Quin inhibitors include Chinese cat's claw, skullcap, melatonin, and selenium. I want to note here that skullcap contains high levels of melatonin, and it decreases the brain's vulnerability to Lyme infection and is protective of brain structures and obviously increases sleep. Interleukin 8 is the primary cause of inflammation and cellular damage resulting from Borrelia infection. Interleukin 8 inhibitors are cordyceps, iastis, and acetylcysteine, Japanese knotweed, as well as doxycycline and minocycline. Interleukin 1 beta is the primary cytokine expressed in Borrelia. It stimulates cell proliferation and increases COX-2 in the central nervous system and increases sensitivity to pain. Inhibitors include cordyceps, boneset, Japanese knotweed, kudzu, red sage, and skullcap. Interleukin 6 crosses the blood-brain barrier, stimulates PGE2 in the hypothalamus, altering the body's temperature regulation process. It affects the hypothalamic pituitary adrenal axis and causes degeneration of neurons in the peripheral and central nervous system, commonly seen in MS, Alzheimer's, and depression. Inhibitors of IL-6 include endographis, iastis, kudzu, red sage, skullcap, and also doxycycline and minocycline. Tumor necrosis factor alpha is elevated in many chronic inflammatory conditions. It affects the hypothalamic, pituitary, and adrenal axis. It causes issues with appetite, body temperature, liver function, insulin resistance, and causes severe brain damage and central nervous system damage. Inhibitors of tumor necrosis factor alpha include endographis, cordyceps, boneset, hatunia, skullcap, and red sage. Matrix metalloproteinases, or MMPs, are collagenases. They degrade the extracellular matrix by breakdown of collagen in the body and release of GAGs. They cause a wide range of pathologies, but they are extremely damaging to the brain and the central nervous system. Japanese knotweed inhibits MMPs 1 and 3. Cordyceps and acetylcysteine, red sage, and skullcap are MMP9 inhibitors. I want to remind you that inhibitors halt the infection. If spirochetes cannot break down the collagen, they cannot feed, reproduce, or spread. So our As Soon as You Get Bit kit contains the herbal formula that intervenes at every step of the infection process. It tackles the transmission phase, the acute infection, as well as chronic infection. And this formula really is meant to deal with everything that we just went over. The cytokine cascade and the way that Lyme breaks down and feeds off of all of the tissues in the extracellular matrix. Now, this formula can be layered with other formulas that are more targeted to actually be antibacterial and or used with antibiotics as well. The herbs that you saw over and over again redundant there were astragalus, echinacea, ashwagandha, Japanese knotweed, skullcap, cordyceps, kudzu, and red sage. So those are all combined in an 8-ounce tincture. And then we have a separate tincture of endographis, which is directly antispirochetal. Some patients have digestive upset and or rash from endographis, so we keep this one separate. And then we also include a half an ounce of bentonite clay powder that you can mix with a few drops of endographis and apply it directly to the bite site.